Good afternoon. In this presentation, I will analyze the biomechanics of the golf swing, focusing on the anatomical movements that underpin performance. Specifically, I'll examine the three key phases of the swing: the backswing, downswing, and follow through. Then I will turn to the rotator cuff, one of golfers' most important yet at-risk muscular groups. I will explore the anatomy of the shoulder, discuss the etiology of how a forceful golf swing can contribute to injury, and to finish, outline the consequences of this injury on both performance and biomechanical efficiency. Now, at first glance, golf may appear to be a leisurely sport. It's often viewed as slow, methodical. However, the golf swing is one of the most explosive and technically demanding motions in this sport. It requires a rhythmic sequence of coordinated movements to generate energy quickly, transfer it efficiently, and control it with great precision, like a chain reaction of falling dominoes almost. Now, from the ground up, the feet, ankles, knees, hips, wrists, elbows, shoulders, and spine must sync. Each of these joints operate across different anatomical planes, and the muscles work in various ways to move, stabilize, and generate force. Now, when these move in harmony, the result is a powerful, accurate drive down the fairway or the deft little nudge to the pin. But when they do not, injuries occur. Throughout this presentation, I will break down the anatomical movements of the golf swing using appropriate terminology, highlight how these movements contribute to power and accuracy, and link them to the mechanisms that underline a rotator cuff injury. By doing so, I aim to demonstrate how biomechanics explain outcome and performance and why it is essential for protecting athletes from injury. This understanding of movement paired with science can be used to improve skill, maximize efficiency of the swing, reduce injury, and ultimately ensure the continuation of leisurely golf and the functional body. In this first part of the analysis, the golfer's swing is sectioned into three frames. Each frame addresses how the joints, muscles, and anatomical planes coexist to create a whole body movement. The golf swing appears fluid and seamless in real time, but at a pause, it can be categorized into three swing phases, each movement engaging the next. So in this first frame here, the golfer initiates the beginning of the backswinging motion. Here, the right shoulder can be identified as the trail shoulder. It adducts in the frontal plane before externally rotating through the transverse plane, moving the golf club over his shoulder. Meanwhile, the leading left shoulder adducts across the midline of the golfer's body across the transverse plane. Now, both shoulders are set in motion by the concentric and eccentric loading of the deltoid muscles and rotator cuff muscles. According to research by Lucas in 2021, highlights that beyond 30 degrees of abduction, the levator scapulae plays a crucial role in becoming the primary agonist muscle. As the trail shoulder rotates, the trapezius and rhomboid muscles in the upper back retract the scapula, allowing the movement and for the club to reach over the shoulder and enable full range of motion. At the elbows, the right arm is slightly flexed in the sagittal plane by the contracting biceps brachii. In contrast, the left elbow extends a lot more, controlled by the three tricep heads, the long, lateral, and medial heads, extending the range of motion. Muscles like the flexor carpi radialis, carpi radius long and brevis set the wrist into radial deviation towards the thumb, helping to roll the club over that trail shoulder and maintain a proper grip. Now looking towards the trunk. Now this is the catalyst for this phase or this sequence. The thoracic spine exerts maximal rotation led strongly by abdominal and erector spinae muscles. The lumbar spine remains anchored to maintain stability and protect the spine from strain. The pelvis begins to rotate towards that trail leg. The trail hip internally rotates and slightly extends, whilst that lead left hip transitions into external rotation and extension. This movement generates the momentum that's required for that powerful downswinging motion in the next sequence. Bradley in 2013 refers to this motion as like a coil, likening the contorted body to a spring that's ready to explode upon release. The knees flex like the elbows in the lower body. The right trail knee, you'll notice, is slightly flexed, so front knee, which helps to absorb those rotational forces and otherwise placing significant strain on the meniscus and the other ligaments in the knee, particularly the medial ligament. Now, this swing stage is like a power up where the body is at its most significant point of muscular tension, and the muscles contract while the joints contort to prime that body for the propulsion, like that swing. Moving into the next slide, the Australian Golf Digest magazine in 2025 argued that this is the most crucial phase of the golf swing, where the dominoes begin to fall. That spring like snaps into action. The golfer begins that downswinging motion to initiate contact with the ball, starting with the shoulders. That right arm extends through the contraction of the deltoids, the pectoralis major in the chest, and the brachialis muscles in the arms. Simultaneously, that left lead shoulder moves horizontally across the transverse plane out of internal rotation, which is also driven by the deltoids and pectoralis major muscle. The upper body helps guide the golf club through almost like a fulcrum, like a lever. Both elbows, you see, remain slightly flexed through that contraction of the biceps brachialis muscles, and it provides that nice stability for the smooth swing. The wrists also maintain that radial deviation, like I said, towards the thumb, which is crucial for that positioning of the club head angle coming through to make contact with the ball. Again, you'll see at the trunk, the thoracic spine begins to rotate back through the transverse plane and extend slightly into the sagittal plane to that leading hip and shoulder. And now this is powered by the latissimus dorsi, that big muscle in the back, the erector spinae in the lower back, and the obliques in the anterior region of the body. The thoracic spine must be mobile and limber, as it's a prime mover for this dynamic phase of the swing. And whilst the lumbar spine remains that anchor that stabilizes the body and protects against hyperextension. Now, as the pelvis rotates towards the fairway, that trail hip transitions through the transverse plane again into external rotation, and the leg straightens while that lead hip undergoes internal rotation. This rotation in the trunk and hips generates a huge amount of torque. Meanwhile, the knees remain in that flexed inflection. The eccentric movement, rather, is stabilized by the big, strong quadricep muscles, providing strength and reducing internal rotation of the knee and strain on medial ligaments. This frame emphasizes the dynamic movement of the golf swing and the extreme torque that can be generated. Following this unfurling of energy in the downswing, the body carries momentum into the follow-through, as shown in this third frame. The golfer completes the downswing and transitions into the follow-through, often with an esteemed gaze upon the shot. You'll see his lead left shoulder moves into abduction and flexion across that frontal plane, which is primed by the anterior and middle delts. And in tandem, that trail shoulder internally rotates and adducts across his midline, which is powered again by the pectoralis major muscles. And it's stabilized by the rotator cuff muscles, which are in full extension. These opposing actions mirror each other, which allows the club to finish high across that lead shoulder, which is as described by Sean Cochran Sports Performance in his 2025 article. Now at the elbows, you'll see that lead arm reaches full extension, which is allowed by the triceps muscles, whilst the trailing elbow is fully extended and abducts the frontal plane. Now again, the wrists play a crucial role, but shifting into ulnar deviation towards the pinky, mimic the grip, and that swift rolling of the wrist upon ball contact really helped to guide that shot. Now, again, the thoracic spine rotates toward the sagittal plane, which is led by under that eccentric control of the firing lats and obliques when they're right at their lengthened stage. And in this phase of the swing, the lumbar spine as well slightly extends, while still you'll see maintaining that form and alleviating any potential overload in that lower back. The lead hip maintains that internal rotation while the trail hip adducts across that frontal plane. Both knees extend with the energy transfer onto that lead leg there, you'll see, while the ankles plantar flex when the gastrocnemius and soleus in the calf muscles contract, setting that golfer slightly on his forefoot, as you can see. As explored by Hardy and Pollard in 2005, the follow through is heavily dependent on the eccentric muscle action, particularly in the rotator cuff muscles, the infraspinatus and teres minor. They're essential in this role. They control the deceleration of the arms and prevent overload in that shoulder joint. Without effective control, these forces generate such a powerful swing that it can cause significant injury to the shoulders. If you imagine the smooth application of car brakes as opposed to slamming the brakes on in a hurry, you can imagine what would happen inside the shoulder. With the mechanics now outlined, this brings me to the next section of the presentation, where I'll focus on the understanding the rotator cuff and how associated injury affects biomechanics. Now, the shoulder joint, known anatomically as the glenohumeral joint, is renowned for its extraordinary mobility, which is described by McLaren in 2012 in their article. It's a ball and socket joint where the humerus head, which is the superior end of the bone, articulates in a shallow glenoid fossa in the scapular bone, and like this. This complex joint allows for almost 360 degrees of motion across the sagittal, frontal, and transverse planes. And such mobility makes the shoulder highly functional for complex movements like the golf swing. But unfortunately, this freedom of movement does come at the expense of stability, making it particularly vulnerable to injury. Now, as described by Malik in 2015, the shoulder is a complex structure. It's constructed of several bony articulations, like the glenohumeral joint, the acromial clavicular joint, which is commonly the AC joint, and that's between the clavicle and acromion of the shoulder if you palpate that bony region there. The sternoclavicular joint between the sternum, which is in your chest, and clavicle, and the sternoclavicular, sorry, these structures provide the foundation for upper limb movement, like swinging the golf club, and key bone structures like the humerus in the upper arm, the scapula in the posterior region of the upper back, and the clavicle, which is more simply known as a collarbone. It's also, these bones are supported by several ligaments and tendons that act like the glue between the bones and contribute vital support, particularly like those. This dynamic shoulder movement in golf relies heavily upon the surrounding and stabilizing armory of muscles like the rotator cuff, which is shown in this diagram. This is more of a posterior view, but you can see just the wraparound of so many muscles and really supporting that joint. The rotator cuff is made of four muscles: the supraspinatus, which is in the superior, like the top region, the infraspinatus, teres minor, and subscapularis. Now, these muscles support the humeral head in that shallow fossa while allowing for abduction, adduction, internal rotation, external rotation, and other larger muscle groups like the deltoids in the shoulder, those three heads, the trapezius, which is the back here, rhomboids, and the latissimus dorsi, that big muscle in the back, enable greater movement. During the golf swing, the rotator cuff is under constant demand. The explosive, repetitive, and rotational movements impose heavy recruitment of these muscles, particularly in the backswing where the trail shoulder abducts and externally rotates. These actions are driven by the recruitment of the supraspinatus, infraspinatus, and teres minor muscles. In the downswing, these muscles play more of a stabilizing role when that momentum generates, working to resist that fast, high force internal and external rotation of the shoulders. In the follow through, the rotator cuff muscles act eccentrically, again, to decelerate the humerus in the joint and the club head speed, essentially. The activity of the rotator cuff muscles in all phases of the swing just underscore how prone these muscles are to overload. Specifically, the supraspinatus, which is the most superior of the muscle grouping, it is it originates in the supraspinous fossa and then it extends laterally across the scapula and inserts at the greater tubercle of the humerus, which is like that very outer bony region of the humerus. Its continual recruitment in swinging movements bear the most significant stress, and it's the most prone to tearing of those four muscles that make up the rotator cuff. Now, the etiology of the rotator cuff tear is multifaceted. Tears will most commonly develop through overuse and repetitive microtrauma, where that repeated adduction and external rotation of the swing, reaching right behind, accumulate a lot of stress on the tendon, which leads to a tear in the muscle fibers. Performance Golf actually calculated the average PGA Tour player takes approximately 72 shots per 18 holes played. Now, if you imagine the load of multiple training sessions and tours, and the days, weeks, months, and even years accumulate, that's extreme overload. And over time, this repetitive strain weakens that tensile strength in the muscle and tendon, the ability to take on load, and increases the risk of a partial tear and, in worst cases, a full tear. Another factor in the rotator cuff tear is poor biomechanics being a major contributor. If a golfer, for example, were to experience limited hip or thoracic spine mobility during that rotation, it can force the shoulders to overcompensate for that limited mobility. And when that mobility is lacking in those regions that usually dominate with the rotational power, it increases the required range of motion and strain upon the shoulder and those rotator cuff muscles during that big swinging arc motion. So if the hips cannot rotate, nor the thoracic spine generate that transverse plane of rotation, the golfer will often unconsciously transfer this demand onto their shoulders. Consequently, the shoulder joint forces excessive range, and this compounds into impingement, instability, and then unfortunately tears as well. Similarly, muscular imbalance or weak stabilizing muscles like the serratus anterior and trapezius can affect the swing biomechanics. And this was documented by Meister and Andrews in 1993 in a really good article. The scapula acts like a base of movement. And so when these stabilizing muscles are weak, the need for that rotator cuff muscle stability magnifies. So, for example, during the downswing and the impact, when the force is at its peak, this imbalance means there's significant strain upon the rotator cuff muscles. Now, whilst it's most unlikely, the rotator cuff muscle can also suffer an acute tear from blunt force trauma due to mishits. So striking the ground before impact, like in this picture here, hitting in the rough, even swinging without conditioned muscles, they all overwhelm the rotator cuff muscles instantly and will lead to like sharp pain, weakness, and loss of function, which signify a tear. Here's a rotator cuff injury. Now that we understand how rotator cuff injuries occur, I'll transition into this phase. What happens next? The real impact on the movement, the golf swing, and overall performance. Uh, Revealing the impact of a rotator cuff tear, it is key to understand that its impacts will transcend far beyond the golf course's green. The rotator cuff, it is central to the biomechanics of a golf swing, but it's also essential for a wide range of everyday movements. So when these muscles are compromised, the consequences are far more significant than the golfer's athletic performance, but also just daily function. As mentioned by Mafuli and Furia in 2012, the rotator cuff muscles play a crucial role in that positioning and stabilizing, again, of that humeral head inside the glenoid fossa during arm movement. Uh, and now this stability enables overhead reaching, lifting, performing many specific tasks. And when there's a torn muscle there, these mechanisms are severely disrupted, and depending on the grade, how severe the symptoms are. Now, from a biomechanical perspective, the repercussions are quite clear. For example, the supraspinatus initiates at first 15 degrees of arm abduction, as explained by Gorman in 2022. Now, if torn, which we know it is the most common, the deltoids can still abduct the arm, but the supraspinatus that isn't supporting as effectively. The humeral head doesn't rotate as smoothly, and that can cause impingement when that space narrows. Similarly, in a tear, that infraspinatus or teres minor muscle, it weakens the shoulder's ability to externally rotate, where it would be difficult to really engage that golf swing. So yeah, applying this to a golf swing, the repercussions are even more magnified. A rotator cuff muscle tear inhibits a range of motion at the shoulder, particularly, as I said, in that abduction and rotation, where it would shorten that ability to backswing. And that tear decreases the torque or the ability to generate torque by that upper body and lower body, which consequently leads to a weaker downswing and then a consequent loss of club head speed, which affects the shot, particularly if you were at the start of a hole driving off a tee. The golfer would struggle to control the club without sufficient stability, which would lead to inconsistencies and erratic ball flight and shot control. You just really have a bad day. Finally, without that eccentric control in the follow through as well, where those muscles are really lengthened, without that deceleration ability, it becomes a real issue where other parts of the body will overcompensate, like the spine, elbows, really any muscles or joints. And that's when that overcompensation not only diminishes performance, but also increases the risk of secondary injuries, which is not great. Um, as told by Imhoff and Savoy in 2019, that beyond the green, there are significant repercussions as well to the quality of life and occupational activities, which a shoulder injury is really noticeable during sleep, often disrupted as lying on that affected shoulder compresses the injured tendons and muscles, leading to severe pain. Pressure causing pain is a hallmark feature of rotator cuff pathology. And for example, if this injury were to affect a manual laborer or a golfer just having time off, they would struggle to perform lifting, pushing, overhead work, and that pain would increase. And so that fatigue of those muscles and really just affect their ability to function optimally. Now, even sedentary workers might find it uncomfortable, as the rotator cuff muscle stabilizes prolonged typing and mouse use and stops that rounding of the shoulders when you see sitting at a desk. And from a pathological standpoint, I mean, if left untreated or poorly managed, obviously the repercussions can worsen over time. A small partial tear may progress to a full thickness tear across the belly of that muscle. Persistent instability can cause, like I said, that impingement bursitis, which is um, like a localized pooling of like fluid and in the bursa, and even degenerative arthritis of that shoulder joint, which is horrible. In many cases, patients or golfers would unconsciously avoid that affected arm over time as well. And that leads to muscular atrophy and further weakness, which compounds into even more functional issues when that shoulder isn't really working at all anymore. And now this cascade of problems illustrates how localized injury can lead to larger musculoskeletal dysfunction if it's not addressed. And then not only are there physical impacts, but there's also obviously psychological impact. Whether it's an athlete or an amateur golfer, um, there is potential to develop, anxiety surrounding the injury and not knowing how to fix it, manage it. Also, a loss of personal expression through avenues like golf. Having that taken away can also severely affect the overall well-being of the person, and that frustration due to the inability to perform as desired. And finally, even everyday tasks that are often once taken for granted will seem impossible. Now, to wrap up this presentation, it's essential to bring together the biomechanical movements in the golf swing and consider their implications for movement, for performance, and injury. Uh, we know, we've established that the golf swing is a whole body sequence in the sagittal plane, flexion and extension at the hips, knees, elbows, and wrists help shape that beautiful swinging arc and tempo you'll see. And in the frontal plane, abduction, adduction at the shoulders, and those subtle deviations of the wrist that assist the club path and width. And in the transverse plane, powerful thoracic spine, pelvis, and shoulder rotations uh, generate the torque for that club head speed coming through in all those three key swinging phases as addressed in the earlier frames. And all three planes are in constant motion, working together, almost like interlocking gears in a machine, just transferring energy from the body to the club and then ultimately the ball. And as we've established, at the heart of this chain is the shoulder complex, and more closely within it, the rotator cuff muscles, as we've addressed. Functionally, the rotator cuff is both a mover and a stabilizer. It accommodates for that abduction and rotation that we see in golf. It also helps to maintain that position of the humerus and enables larger driving muscles like those deltoids in the shoulder, the lats in the back, the big pecs, and the gluteals in the buttocks, those really big, powerful drivers to fire and really get that shot going. Uh, the importance of the rotator cuff, can't be understated. It does have varying roles across those different phases of the swing, which was explained. Like in the backswing, there's that it drives the adduction, the external rotation, that stability. In the downswing coming through, it works to isometrically anchor the joints and then coil up those trunks in the hip to then release the energy. And in the follow through, it acts eccentrically when those muscles are at that lengthened position to act as like a brake and decelerate the arms against that momentum. Now, understanding these sequences highlight why injuries occur and at what cost. Repetitive cycles of 360 degrees of movement in conjunction with high speed deceleration can cause that micro trauma with the intense strain on the tendons, which cause that tear. in the fibers, and while limited mobility in other areas can cause excessive strain on the shoulder joint, muscles, tendons, ligaments, you name it. And weak stabilizing muscles as well can affect that smoothness of the swing, as we know. And on the odd occasion, even sudden blunt force trauma can produce that acute tearing. And then, as mentioned, beyond the swing, it's important to understand that other factors are affected beyond the injury, like that pathological, psychological, and quality of life. Uh, Specifically to golfers, the repercussions of the injury are evident, aren't they? The onset of secondary injury, a shortened backswing, which reduces mobility, torque, and power. That less stable downswing just leaks energy, which slows the club head speed. At impact, that instability causes inconsistent shot and that poor shot making. And in that follow through, that poor eccentric control uh, would just destroy the shoulders without that ability to break. Overall, the message is simple. The rotator cuff is a key cog in many functional movements. In this particular presentation, the golf swing, protect it, flow with it, and those chain of movements you see just flow so smoothly and efficiently. Uh, Damage it, and every facet of the mechanical system suffers. This protection of the cuff means maintaining mobility, building control in those little stabilizing muscles that um, help function, strengthening those muscles in various ranges of motion, and then also refining training load and technique for golfers, for those professionals as well. You know, that accumulation can really affect the overall health of the body. And ultimately, golf may appear leisurely, but as it has been presented, there's many biomechanical factors that must be considered to remain performing on the green and staying functional in life. Thank you for listening, watching my presentation.